First of all, welcome in this COVID era where we're trying to get everybody to know each other. This is our first kind of meet and greet. I'm Charlie Furl. I'm the program director for the University of Virginia, and really excited to kind of start to get to know people around the country, and hopefully for you guys to get to know us a bit. We're super proud of our program, and we're just trying to get the word out. And so this is a session. We're going to have 3 separate sessions over the next 3 weeks. And so this session in particular, we're going to focus on, it's kind of the operative experience and living in Charlottesville and what that's like. And what I've done to try to give you guys a different flavor is I've invited 3 of our alumni guests to come back. Sarah Hennessy, who I don't think is quite joined yet, but I think is going to be on shortly. And who graduated about 5-6 years ago and now is on faculty at UT Southwestern. Brandy Edwards, who graduated a few years ago and is now one of our faculty members at our VA, and Pooja Shah, who is now just finishing up her colorectal fellowship at the Mayo Clinic. And I really wanted them to kind of give you guys a sense of not only what it was like when they were here, but what it was like when they got out beyond here, and hopefully tell you guys that they were prepared. Before we get to that, I'm going to share my screen now. And and just kind of give you what I hope would be a pretty quick presentation. I really want to get to these guys. Now, Kristen, I do need you to just tell me, can you see me okay? You see that, Kristen?
What was that?
You see the slides? Everything's okay?
Everything's good.
All right. So that's who we are. And so first of all, who are we and what are we trying to do? So we are an academic program, and our goal is to train, kind of academic surgical leaders. Clearly, we want you to be good clinical surgeons. I mean, that is first and foremost by far, and I think we do an extremely good job of that. But we do focus on, the educational mission and the scholarly mission as well. And we're particularly focused on making sure it is done in a positive and inclusive environment so that you can grow as the person that you need to be. And so, what are we trying to do? We're trying to take, all of you and make you into these 5 folks. These were our 5 chiefs from last year, and this is where they went. We have 2 that stayed here at UVA for cardiothoracic, 1 that went up to Michigan for her endocrine fellowship, 1 that went down to Wake Forest for a minimally invasive, and we have a resident at MD Anderson. And so very impressive fellowships combined over, nearly 300 publications, tons of awards, tons of podium presentations, and 1,000 cases. So these people did exactly what we were hoping to do, which was that they were, skilled in all these areas. And that's our goal. We already kind of mentioned, but our residents are very competitive at fellowships throughout the country. I was very, Pooja's up there at Mayo Clinic right now. We've had multiple ones go to MD Anderson, Sloan Kettering, University of Florida. Our current chiefs are going to be going to the University of Colorado for transplant, Louisville for pediatrics, and then 1 will be going to colorectal, and she hasn't heard yet, but she's going to be one of the top recruits in the country. So just very, very skilled people that go on to very high-level positions. As I said, we are, training academic surgeons, and so most of our residents will go into fellowship training, almost over 90%. Not everybody, and Brandy Edwards is an example of that, and she's going to be able to speak to that. Most do some sort of dedicated research time, usually 2 years, and up to 1/3 of them will be getting advanced degrees. We've had 3 residents in the last 5 years actually pursue a PhD, do 3 years in the lab to get a PhD. And up to 3/4 of our residents will end up in some sort of academic environment when they're done. So does that mean everybody? No, it doesn't, obviously. But I think if your vision of yourself is to be in a kind of rural community practice, then perhaps this is the right place for you. But if you have a change in heart, we will do whatever we do to make you the successful surgeon you want to be. How do we go about doing that? We do spend the first 2 years in clinical. We then go into the professional development years in year 3 and 4, and then you come back and do your 3 successive clinical years, including chief resident year. And as you can see, about 80% of our residents will follow that path. we will have a few that don't go into the research years for one reason or another, but you can see the overall majority do that. So most spend about 7 years with us. We do most of our rotations at the UVA hospital, but we do have a rotation at the VA where Brandy Edwards is now on faculty. And we've just added actually a community rotation at Culpeper and now a bird experience at VCU as well. We will focus on this in a couple of weeks, but I think this speaks to our overall culture. Very few of our residents leave. And when they do leave, they leave because, they just decided surgery wasn't for them. They don't leave because we have a malignant culture. The people that want to be surgeons, they come and they train, and we allow them to grow into the people that they want to be. This is our board pass rate, just to give you a sense. We haven't had anybody fail the boards in quite some time, either the oral or the written, and so we're quite successful at that. This is just a sample log. I mean, the thing I really want to focus on, if we do about 1,000 to 1,100 cases, which is very competitive with the nation, we widely exceed all the minimal limits in all the different categories. The most important thing to really understand, though, about our culture here, as far as the operative experience, is that we have very few fellows, right? So when you go to do the surgical oncology, all the Whipples are yours. All the lever sections are yours. When you come and do colorectal in my service, and that's what I do, I'm a colorectal surgeon, Pooja Shawberry did all the colorectal, all the J pouches, all the APRs, all the laparoscopic complex stuff. We do have a vascular fellow, but even that experience has really grown tremendously because we've cut back a little bit on those. But we have very, very few fellows. And we've made a conscious decision to that. I want to train I want to train residents that are going to go out into the fellowship world and be the top recruits at all the top places. And that's what happens. So when our residents here leave, they're recruited very heavily, and they end up in like Mayo, like Pooja Shawberry there. And we expect you to be technically great when you leave, not just good. In my humble opinion, I'm very proud of this, but the residents leave here better than I was trained. I mean, and I went to a great place, and I love my place, but they're better trained. And we give them appropriate autonomy. We are highly supervised in the appropriate way. But this is just actually, John Davis is now on faculty now, but he's doing a case, I'm the attending, and he's doing this with a fellow resident while I kind of supervise. So you will get the autonomy that you need. This is a slide just to remind me that we're going to talk about research next week, but it's a part of our culture. It's very, very important. And if you want to hear about this more, please tune in next week when we have our vice chair for research on, and she can kind of go over that in more details with you. But it is part of our culture. It's part of who we are. Similarly, we are very much into education, right? So we want people that want to train the next generation. And we're really good at it. These are just two of the most common books that are used by fourth-year medical students, and they both came from UVA. You can see here, I've just, Dr. Pooja Shawberry and Brandy Edwards, both, I think, were finalists for these awards. But we've had 3 women win the AWS Outstanding Resident Award, the number 1 in the country. We've had 10 that have been top 10 in the Professionalism Award. 18, 19, and 20, we've had a resident receive that. And it's just really gratifying. And these are all national awards, not to mention all the local awards we win. So it's a big part of our culture, and we'll talk about that more in detail next week if you want to join us again. And we expect you to be leaders. We expect you to be leaders in our department, but we expect you to be leaders within the institution. And our residents are on the forefront of every issue that not only is important to us as a community, and it's important to us as an institution. We are going to spend an entire session on this as our 3rd session, but diversity and inclusion and being collegial, as you can imagine, is very much important to us. We will talk about the events of August 12th in 2017, but it's been a big deal here, not just of course across the rest of the country, but in particular here in Charlottesville. And we'll get to that at a separate session. I do want to speak a little bit. We are in the heart of the university, so the hospital's right there. So the university culture is a university town. I think a lot of times when you go to other institutions, and it's not good or bad per se, but if you go to Cornell Hospital, you're nowhere near Cornell University, right? But UVA, you are part of the university and part of the system. It's right there. My office is, in fact, this view, this is the lawn. It's literally right behind where I'm sitting right now. What does that mean? That means that there's collaboration with the university. That means there's activities to do within the university, whether it's cultural activities or sporting events. And so from a social perspective and a scholarly perspective, it's sitting right there for access for you. A little bit about Charlottesville. Charlottesville is in central Virginia. It's in the heart of the Blue Ridge Mountains, and on multiple surveys, it's always kind of one of these top 5 happiest places to live or nicest places to live. And it's partly because of this. We are literally in the heart of the Blue Ridge Mountains. So if you're a hiker and you're in the outdoors, it's all readily accessible. And you know, the thing that's really great about it is it's within 30-minute drive or 10-minute drive or 20-minute drive. So you can literally be on call, do your cases, do what you need to do, and get in a car and be at the top of a mountain, you know, within a few hours. There's lots of rivers and activities. I'm more of a lake guy. There's not a whole ton of lakes, but there's a lot of rivers and fishing and whatnot. It does get cold. You know, when I came down here from the Northeast, I thought I was going south and it would never get cold. We even have a ski mountain within striking distance. It's not quite the snow country that you get perhaps in the Northeast or in the Midwest, but certainly we have 4 seasons, and that's important to a lot of people. This is the picture of our downtown mall. There's tons of restaurants. It's a kind of it is a small town with a big town feel, right? So there's lots of activities. There's lots of music, lots of concerts. If you're into ACC sports, in particular into the NCAA basketball, we're now, I guess, 2-time champions since we didn't get dethroned last year due to COVID. But there's lots of different events for people to go to, and again, readily accessible. And this is the thing I wanted to stress here is that, you know, since I've been in Charlottesville, I mean, the Rolling Stones have come here, U2 has come here, Bruce Springsteen has come here. I mean, obviously you're getting a sense of the music I like, but it's a, you know, a relatively small town, and yet big things come here. And what I want to, the story I like to tell people is it's accessible, right? So when I lived in Boston, all those things went to Boston, but I never did anything. And why is that? Because it was just too hard, right? But when Springsteen came to town, I worked to about 7:15. I called my daughter, who was in the 6th grade at the time, and I went to her school to go to some basketball game that she was participating in. I did a school event with her. We got in the car. I drove to JPJ. You know, we were in our seats by 9:15. Springsteen came on. He played for a couple hours. I left, and I was home in bed by 11:30. And that is impossible in a major city, you know. And so the net result is, what I like to say is things are accessible now. You're going to be busy, so you want to be able to get out and get to things, and you can do that in Charlottesville. This is a typical housing for our residents, and they can speak to that a little bit more when we get to the breakout sessions. But a lot of our residents own houses. It's very affordable. It's very close to town. And it's very, like I said, a pretty easy place to live. This is just 2 of our residents showing their home, but Katie actually just, I think both of them own their homes. So these are readily accessible for people. And while it's a little bit more expensive than it used to be, it's certainly nothing compared to, you know, the Bostons and the Chicagos and the San Franciscos of the world. And so, you know, I think one of the things I hope you're going to get a sense of it tonight, and if you come back and join us with our other sessions as we focus on some of the other aspects of our residency, is that it's a close-knit group that really, really cares about each other, and really is focused on supporting one another so that you can become the surgeon, and not only the surgeon, but the person you want to be. And you know, and for so many people that includes children. And so these are just all the children. Many of them were just born last year or so, but we have, you know, many people that are parents. Not everybody's a parent, but many people that are parents. And And it's important to us that you're allowed to develop not only as a surgeon, but as a human being. And these years are really, really important to you. So we take pride in that, and we'll support that. We work hard, but it is also a time to allow you to grow in all capacities of your life. And so, this is what we're thinking, this is what we look like now. So, you can see, looks like we all got masks on appropriately. The question is, can this be you? And so you're going to look and you're going to try to go to a lot of different places and just say, listen, is this a fit for me? Is this the place that I want to train? And so ask a lot of questions. And, that's kind of all I got from my kind of hopefully relatively short presentation. And so what I'd like to do now, if it's okay with you, is I'm just going to actually let our guests introduce themselves and let them talk a little bit about what their experience has been, not from a program director's perspective who's going to say everything's great anyway, but, from, how were they prepared and were they prepared when they went to the next step? So with no further ado, I'm going to let our guests introduce themselves. Brandy, why don't you go first? You there?
I think Pooja was going to go first and she's got a case.
All right, Pooja, why don't you go first?
Hey guys, I'm Pooja. I'm one of the current colorectal fellows at Mayo Clinic. So I just finished at UVA almost over a year ago. I'm about to be done with my fellowship. I grew up in New Jersey. I went to New Jersey Medical School, and then I actually did an away rotation at UVA as a fourth-year medical student on Dr. Friel's service, as a matter of fact. And he was a huge reason that I was interested in going to UVA. I mean, it was very clear to me early on that the faculty there was just super interested in resident education and personal development, and just the interactions that I saw between residents themselves and then also the faculty and the residents was really something that I was looking for. It felt much more like a bunch of friends or a family feel, not at all like a malignant place. And, if I had to choose residency again, I would like 1,000 times pick UVA as my number one. And then I moved on here to Mayo Clinic for my fellowship, like I said. And I'm just finishing up. I'll be done in about 2 weeks. So I've had a full year of that. And the thing that everybody always wants to know is, did you come out of your training program trained? And I am certain that probably like 99% of people never feel trained. You never feel ready. However, like literally the first day that I walked into Mayo, I was in the OR and somebody was like, okay, get started and call me when you need me. And at first I panicked for about 5 minutes. And then I realized, like, I actually know how to do things. Dr. Friel, Dr. Hedrick, they taught me really well. And so I did. I got started, and, you know things that you don't even realize you have learned, because that is the type of program it is. There's just so much focus on people teaching you when you're a younger resident, and then as you get older, you just get, like he was saying, this progressive autonomy, and you just pick up so many things that you're subconsciously picking up. And then from here, I will go on to a job that I took in Pennsylvania, which I can talk about more later. But Brandy, why don't you go ahead?
Sure. So I'm Brandy Edwards. I graduated in 2018. I immediately joined faculty at the Salem VA, which you'll spend about 5 or 6 months out of your residency through UVA, rotating here. I went to medical school at East Carolina. I did my undergrad there too. And when I came to check out, different residency programs, I was immediately drawn to UVA. As everybody says, it's about the people. I met so many amazing people when I came for an interview. I loved how the residents interacted with each other, the collegiality that they had with all the faculty. I came back for a second look, and I actually met Sarah Hennessy, who is going to be speaking next. And I can just remember just meeting her and hanging out with her for like an hour when I came for a second look. And I was amazed by her. I wanted to be her. And I mean, I immediately put UVA as my first choice. It was just meant to be for me. I loved Charlottesville. It's such an easy place to get around. It's really easy to live near the medical center. I was able to get to work, within just a few minutes. Parking is nothing compared to a lot of other places that I looked at. So it's a really easy commute to get in and out. And we were able to own our own home like the whole time that we lived in Charlottesville, which was amazing. When you actually do come to the VA rotation, it's a couple hours away from Charlottesville. You're set up with your own apartment that you stay in, like a 2-bedroom, 2-bath apartment, and you're here, a couple hours away. And I came actually down as an intern and fell in love with the VA. And that honestly is what really pulled me to want to do that. I had a lot of other ideas of what I thought I wanted to do. But the VA roped me in really quick. During residency, I had a lot of great experience, a lot of great rotations. Everybody knew my intentions of ultimately coming to the VA, so I was able to tailor some of my experience that I got during my residency based on what I was going to be doing here. I had a couple of kids during residency, which I'm never going to say it's easy, but you can do it. In terms of the operative experience, it's a phenomenal experience. I mean, I came out without a fellowship and went straight into a very broad general surgery practice. The graduated autonomy that you get at UVA, as Pooja says, you just subconsciously pick up so much that you're not even aware that you know all of the things that you know. And, of course, starting out fresh out of residency, I was, of course, anxious for these big cases because, I wasn't getting like the little small inguinal hernias and things like that. The stuff that came to my clinic were mesenteric masses, retroperitoneal sarcomas, people with rectal cancer, esophageal diverticula. It was all over the place. And I was able to do it. And I felt like overall, while it was kind of scary at first, I was pretty seamlessly able to transition into being on faculty. I do such a broad scope here. I do a lot of colorectal, a lot of, bread and butter general surgery. I do most of our endocrine practice here. I also do thoracic, doing VATS, lobectomies, etc. So I can tell you that the operative experience we get is extremely, extremely adequate and phenomenal. And you're going to come out very, very well trained.
Yeah, in fact, Kristen has pointed out to me, by the way, you do have the ability to ask questions. I think you have to raise your hand so Kristen can unmute you. And by all means, if you have a question and you want to do that, please hit the little button that raises your hand so she can unmute you. But I think that Brandy is a really an excellent example of the fact that she was not fellowship trained, and I think there's a kind of a belief out there that many people throughout the country are doing fellowships now because they don't feel adequately trained to go into practice. And as I said about earlier, we have greatly limited our fellowships here so our residents get all those cases. And I think that just speaks to the fact that she was prepared. And I think Pooja was prepared to excel at Mayo. And we put you in that position to excel anywhere you go. And I think Dr. Hennessy's on the line too, so.
Hi, everybody. I'm Sarah Hennessy. Brandy, that was such a great story. I didn't know that. I hope I live up to everything you just said to everybody.
Absolutely.
So I graduated, gosh, I feel a little old now, but in 2013, sorry, I had to think about it. I grew up in Northern Virginia, and I did college and medical school actually at the University of Virginia, so a little bit different than Brandy and Pooja. And then I loved, honestly, UVA so much, and I loved living in Charlottesville that I stayed for my residency. And then I did 2 years in the lab. And then I ultimately stayed and actually did 2 fellowships, probably 2 of the few fellowships that Dr. Phil mentioned. I did a trauma critical care fellowship first at UVA, and then I stayed on to do an MIS bariatric fellowship, which is a little bit different, but ultimately planned. And then I came to UT Southwestern in Dallas as faculty, and I've been here for, can't believe it, already 5 years has gone by. I echo what Pooja and Brandy said. I obviously loved UVA and Charlottesville. I lived there for 17 years. It was a great experience at every level, which is one of the things I loved about Charlottesville, was that it was a great place to live as a college student, as a medical student, and then as a resident. And through all those years, I got married, I had kids in residency, and my family grew into fellowship. And it's just a very easy, seamless place to live, and it kind of grows with you through the years. And, you know, residency is a long time, and you'll have a lot of life changes. You'll grow up and things will happen. And Charlottesville just, for me at least, fit kind of every aspect of my life. And it was a really, really hard place to leave. Residency, you know, UVA was my #1 choice. I saw and worked with the residents, and as Pooja and Brandy mentioned, it was just a family, and, you know, everybody had a lot of fun, but learned a lot. And it just, you know, residency's hard, but the way UVA was set up in that program, and every day was just, it was a lot of fun. I came to work, I hung out with the people that I like to be around. I was friends with all of them. We operated, we took care of patients, we had a great time. I had a great relationship with all my faculty. I could call any one of them anytime. And I learned how to operate, and I learned how to operate from faculty. And I learned as a junior resident how to operate from senior residents. And, you know, I started this job and hit the door running and haven't looked back. And so the training was fantastic with really amazing people around me. And that really made my experience at UVA, I think, one that I don't know if I could get it anywhere else. And as Pooja said, I would do it 1,000 times over. It was a really great experience.
So, you know, it's thank you for joining us. I really wanted to get that perspective, not only because we're about to kind of go to our breakout sessions and really allow you guys to really talk to the residents, and we will disappear, and you can ask them anything you want, and you can try to get the true scoop on the whole situation. But I think that, you know, bringing these really 3, I think, shining examples of when I say our program aims, you know, that this is our program aims, right? That someday you could be Dr. Hennessy and be a highly successful academic surgeon, or you could be, you know, Dr. Edwards, you know, thriving in a broad general surgery practice, teaching our residents, or you could be Dr. Shawberry, you know, at the premier colorectal place in the country, and about to embark on your career for the rest of your life. And that's who we're trying to train. And I wanted you to get a feel for that, an example of that. And I appreciate you guys all coming on and sharing that experience with everybody. I think we probably could spend the entire time talking to the 3 of them, but just because in the interest of time, and also to allow you guys to get to really meet the people that you're going to be working with on a daily basis. Unless there's some obvious questions that someone asks right this minute, I'll allow us to get to the breakout rooms, and you can talk directly to our residents and ask all the questions you want, and we'll fade away and we won't listen. Is that okay? Now, before we leave, we're not going to come back, so I am going to say good night. And I do want to encourage people, I hope you like what you heard. If you did like what we heard, I want to encourage you to come back next week, and when we talk about the research and development years and our philosophy on education, and then the following week when we really focus on the issues of diversity and inclusiveness and just generally our overall culture, and how that is incredibly important to us. And I think it should be important to all of you to once again allow you to grow into not just the surgeons that you want to be, but to the people that you are and the people that you want to continue to be. So with that, I'll say good night, and we'll go to the breakout rooms, and I'll let you guys get to business. Thank you for joining us.
Bye, guys.
One question.
Oh, shoot.
There's one person raising.
Oh, yeah, I see a raised hand.
Hey everyone, Anthony Eze. Thank you guys for taking the time to organize this. My question has to do with global surgery. What does UVA offer to people who may be interested in that field? Is that something one could do during that research development time period?
So I will address that, but also we can have the other three talk about that. We have been really successful in that realm. I think two of the residents that have won the AWS Resident of the Year award, Robin Pedrose and Allison Martin, were both very active in the global field. Now, do we have an international rotation that you get plugged into as part of our routine? We do not have that currently. But if you have a passion and you have a will and you want to do this, we have lots of people that are interested in this and have been extraordinarily successful. I think one of the things that we do here is we support your mission, right? So we are going to ask you to have a vision and help us do that. We're not just going to give it to you on a platter, so to speak. But if that's your passion and you want to do that with your research development years, and you come to us with a plan and we'll help figure it out, then we'll make that work. Dr. Mustafa last year had that passion, and we teamed up with the University of Utah, and he went out there and we split the finances 50-50. And he went to Ghana primarily and did a lot of global health work. So we have mechanisms for you to achieve your dreams, but you have to bring the dream. You have to come with the dream, right? And if you have that dream, then we will do our best to make you help you realize it. I mean, what do you guys think? The three of you, thoughts?
Yeah, no, I would agree with that 100%. The people I know best are Robin and Allie, and like you said, they were wildly successful with their Rwanda experience, and I think both of them won Fogarty. I don't know if the term is scholarship or awards or grants, whatever the Fogarty Award is, and they were both, very well published through their time there.
We will focus on, we want this to be an academic experience, not just a kind of a global health experience. We want you to be an academic global surgeon, right? And that would be our focus. We'd say, how are you going to make that, Anthony, into an academic endeavor? But if you have that passion, and Robin and Allie were phenomenally successful at it. And like I said, it allowed them both to be named, the Women Resident of the Year. And in fact, I think Allie won, is it Allie or Robin won the humanitarian award too? I think it was one of them.
Yeah, Robin did, yeah.
So they were extraordinarily successful at it. So why don't we let you get to the breakout rooms, and I'm going to say good night. And I really appreciate you guys all joining us.
Thanks.
Thanks. Bye, everyone.